Good morning.
I work out every day, every morning, and so I was starting to notice that I was feeling really tired, really lethargic, lightheaded. I'm used to working about 12 hours a day, and it got to be where I was so tired in the evenings. Finally, my husband decided he needed to take me to the hospital.
Cancer is the #1 disease-related cause of death in the young adult population. Between 15 and 40, it's the #1 disease-related cause of death.
A lot of healthcare providers are misinformed in that they think that young adults don't get cancer.
Most of the time, people see cancer as something that comes with age. It's the last thing anyone wants to think about, whether it's the family member, whether it's the patient, him or herself, or whether it's the provider. Nobody wants someone young to have cancer.
The first doctor that examined me thought it was just a muscle spasm or whatever, because I told him I'd been doing a lot of working out, getting ready for the Navy SEALs and stuff. And the second doctor that examined me said there's no way it's a muscle spasm because I had full motion. I could, touch my heel to over here. And I wasn't worried at all. I was sitting on the couch just being sarcastic. I was like, yeah, Mom, it's cancer. And she's like, don't say that.
Okay, I'll let him know you're coming, Brandon.
But then when they actually told me that I had a cancerous tumor, I was like, It turned out that my bone had turned into pretty much a rotten log. So it's a really long scar.
We hear so many stories of young adults whose diagnosis is delayed.
I took care of a young adult man who actually let a testicular tumor grow to 16 centimeters before he sought medical help, and he kept it hidden.
Adolescents and young adults often fall through the cracks. They're trying to become independent, and I think people ignore them. They look at that age group as being a difficult age group to work with because they're going through all of the different developmental stages of an adolescent and a young adult, and some of them aren't great stages.
She loves her crazy hats.
We are slaves to routine. But we have to not get so stuck in that routine that the red light doesn't go off and say, whoa, this patient does not fit the standard average patient in my practice. What do I need to do different?
I think what happens when someone comes in for an illness or they come in for a checkup, you focus on what they're there for and you forget about looking at the rest of the person and the rest of the person's body.
I went through about 4 or 5 months of being in and out of the hospital. Approximately once a month, I would have this internal bleeding where my blood levels would get so extremely low that I'd have to be hospitalized. And they would simply give me blood. I was told that I might have a bleeding ulcer, but they never found an ulcer. I was told I might have to have part of my stomach removed, and there was nothing wrong with my stomach. They ran all these tests, but they weren't doing the right tests. I remember my husband, during all those hospitalizations, going in the hallway and talking to the doctors and saying, why don't you just run a scan or an MRI or a CT? And they said, that won't show anything.
I certainly understand it's hard as a medical professional on the other side, where a lot of young adult cancers can present with, either vague or sort of common sort of symptoms, an ache or a pain or a cough.
The nurse is oftentimes that person who has the opportunity to listen.
And to listen for more than words, because this is not a very open, talkative population.
Want me to go slow?
Doesn't matter.
Either way, it doesn't matter. Okay, get it done with then. Nurses can also be a voice for the patient if the patient doesn't feel like they're empowered enough to speak that to the physician or the provider that's seeing them at that time.
You need to look at persistence of symptoms. Sometimes it's not the symptom that's so significant, it's the persistence of that symptom. How long has it been going on? And try to get a pattern, and I think taking a good history is crucial.
It's okay for somebody to have a sore ankle who's an athlete and been jumping around, but if that sore ankle lasts for weeks at a time, that doesn't fit. You don't have to go overboard in terms of every single cough must be a CAT scan of the chest, but to at least have the radar open that serious things can happen, and if somebody's saying, look, this is new for me, this is different for me, to take that seriously.
It got to a point after 4 hospitalizations and 3 blood transfusions later that the doctor said, there's nothing else we can do for you. It was devastating. You never want to be told there's nothing that can be done for you, and you never want to be told that someone's giving up on you. But there was a period of time for about a month there before I actually got into a doctor that said, yes, we can do something. So I just happened to fall in the right hands of a great gastroenterologist who cared, and I remember the first time I met him, he said, they gave you blood and sent you home and did nothing. It was nice to hear a doctor validate what my husband and I had been thinking for so long, and then within 10 days I was diagnosed. I was diagnosed from a simple CT scan. I mean, my tumor was the size of a navel orange. I wish that they had listened to me. I wish they had listened to my husband.
The statistics say it's not going to be cancer, but we don't want to put off the diagnosis in a young adult, which probably is going to impact their prognosis. We want to consider the possibility because the numbers are there. It takes a lot for a young adult to come to a provider. If they especially come back again and say, you know, the ache is just not going away, we need to consider cancer.